Have you ever felt a persistent tightness in your lower abdomen or discomfort in your pelvic area, perhaps even when you are trying to relax? Many people mistakenly think these sensations are normal or that they just need to strengthen their core, but sometimes it is actually a sign of something different. The question of whether your pelvic floor muscles are too tense is an important one, and the direct answer is yes, they often are, even if you feel weak in that area. A tense pelvic floor means these muscles are constantly contracted and struggling to relax, which can paradoxically make them feel weak or unable to engage properly when you need them to. This constant state of tension can stem from several factors, including chronic stress, poor posture that puts pressure on the pelvic region, or even habitually clenching these muscles during daily activities without realizing it. Other common causes include a history of pelvic pain, certain types of exercise, or consistently holding your bladder or bowels for too long. When these muscles are in overdrive, they cannot fully lengthen, which restricts their range of motion and can lead to symptoms like pain during intercourse, difficulty emptying your bladder or bowels, or generalized pelvic discomfort. Understanding the root cause of this tension is the first step toward finding relief. To begin exploring if your pelvic floor is too tense, first pay attention to your body. Do you often feel a clenching sensation in your lower pelvis, even when resting? Try a simple breathing exercise. Lie down comfortably, place one hand on your chest and the other on your belly. Inhale deeply, allowing your belly to rise gently, and as you exhale, imagine your pelvic floor relaxing and softening, almost like a flower blooming open. Another practical step is to gently self-palpate the area around your vaginal opening or perineum to feel for tender spots or persistent hardness, which might indicate tension. You can also notice if you bear down or strain during urination or bowel movements, as this often points to an inability to relax these muscles effectively. Recognizing a paradoxically tight pelvic floor, often called a hypertonic pelvic floor, is a valuable insight beyond just thinking you have weakness. It means focusing on relaxation and releases before or alongside strengthening exercises, preventing discomfort and improving function. Incorporating techniques like diaphragmatic breathing, gentle stretches for the hips and glutes, and mindfulness can significantly help your pelvic floor learn to let go. Imagine these muscles as a hammock supporting your organs. They need to be pliable, not rigid, to function optimally. Ultimately, understanding that a feeling of weakness in your pelvic floor might actually be a sign of excessive tension is transformative. It shifts your approach from constant tightening to learning how to releases and relax these essential muscles, which in turn improves their strength, flexibility, and overall function. This knowledge empowers you to better support your body through daily life, fertility journeys, pregnancy, and postpartum recovery, fostering a healthier and more comfortable pelvic region.